Therefore, today we will discuss in our short webinar those achievements that were developed by him over the last, probably, 50 years. Therefore, we move on to his, firstly, new and in general principles of regenerative medicine. So, colleagues, Maurizio Ceccarelli, biologist, professor of physiological methods in aesthetic medicine, a number of universities. The most important thing is that he is the founder of the Aepymed Center. There is such a center in the city of Rome. It is a group of scientists headed by a professor. It is a scientific committee that is located all over the world, starting from I would like to remind you, what is regenerative medicine? You very often hear these terms at your seminars. Numerous companies, under the types of regeneration, give out not quite the same. So, regenerative medicine is, first of all, it is the restoration of the affected or damaged, traumatized, injured area of one or another system. In this case, we will talk about the dermis, the restoration of the lost number of cells, cellular structures and stages of the life cycle. In other words, if we want to regenerate something in our skin, first of all, and today we will consider with you the regeneration of not only the skin, but we will consider the regeneration of the so-called SMAS, the superficial masculine and erotic system, that is, the whole pie. Which interests us is first of all the dermis. This is fat, muscles, well, and bone tissue. Today we will of course not consider this. So, colleagues, regeneration, regenerative medicine, this is in cosmetology. This is the only future that awaits us. So just a second, for some reason my slide is not switching. So just a minute. Let's do it like this, yeah. Like this. So, I remind you, as they say, everything is ingenious and simple about any interventions, drugs, and so on. That is, in other words, if we have some excellent drug, we plan to inject intradermally, yes, mesotherapeutically, but does not correspond to the pH, then there will be no physiological regeneration. So, colleagues, here is our main protocol, which we currently offer for use. This is the main protocol, probably the most modern protocol, complex in today's regenerative medicine. It includes several points. We will now look at them point by point. So, the general protocol is called skin biostimulation. It is clear, skin biostimulation. So this protocol includes four components. This is the first stage of this protocol. This is the activation of our own fibroblasts. Now we will talk about why we need this. The second stage is PRP, and today the company associated with the professor. It is called nouvera, if you remember the first slide. And it offers synthetic PRP. That is, it is a concentration of all growth factors in one bottle. That is, it is PRP with a guaranteed effect. You know very well that PRP depends. Plasma therapy depends on many factors. On the number, first of all, of the patient's own platelets. First, second depends on the degree of centrifugation, how much the plasma is enriched with these platelets. And third, of course, the combination of these factors, their ratio. That's how innovative PRP is obtained synthetically. Again, only our company has this, for example, which can guarantee an effect. And the third stage of the main protocol, which is called skin biostimulation, is Corona. That is, this is the prevention of chronoaging, and, first of all, one of the factors of this event is the inhibition of the enzyme metalloproteinase. Who does not know? Let me remind you that metalloproteinase is an enzyme. It is the third type. There are many different types. And this is an enzyme that destroys its own hyaluronic acid, which is produced by our fibroblasts. Therefore, blocking metalloproteinase makes it possible to prolong the effect of the three previous actions. The next important section is fat regeneration. Two stages belong to fat regeneration. This is lipolysis. Yes, dissolution of excess fat deposits. And lipogenesis. This is the restoration of lost fat, which each, as a rule, it is connected with gravity. Yes, gravitational tosses. We know that fat packets migrate. Accordingly, the upper middle third of the face we have little fat. At the bottom we have a lot of fat. Therefore, at the bottom we use lipolysis. At the top we use lipogenesis, and we will talk about this. Lipolysis and lipogenesis are also exclusive directions of action of drugs, because you could probably come across lipolysis, but here the issue of safety is very important. How comfortable the procedure will be and how controllable it will be. Here lipogenesis is also an exclusive direction, which you will not come across in other companies. That is, we can restore your lost fat. The next thing is necessarily muscle toning. We know perfectly well that some of our muscles are in hypertonicity, others in hypotonicity. So here, for example, the muscles of the zygomatic manar, they need toning, just like collagen in order to, let's say, gather the skin. That, for one reason or another, let's say, has stretched. This is most often used by platism. And this is the last stage we use in those patients. For whom, let's say, regeneration is not on the agenda. Plus, we use it wonderfully on the body in the buttocks area, in the abdomen, on the surface of the thighs. These are stretch marks and so on. That is, in fact, we stitch with the help of a hypertonic solution of amino acids. A monoglyceride drug containing, we stitch this collagen. It also has a pretty excellent effect. So, colleagues, on your screens, briefly the drugs that you and I will use. So, fat apoptosis body is a lipolytic based on trivalent iron, vitamin C stomach. Now you see the old box, so to speak. Now it will be rebranded and Stamin C is the #1 drug. That activates fibroblasts. Skin optimase is a drug that contains the component that blocks metalloproteinase and is the latest B revitalizant. Unlike all the others, this drug does not contain hyaluronic acid, but contains only parts of it. This means that the fibroblasts of our dermis will synthesize their own hyaluronic acid, masculinizing. Body is clear. This is a drug that tones muscle tissue. In SKK and firming, this is the drug that causes scalpel-free lifting or restructuring of the dermis. So, colleagues, to begin with, I want to tell you why we will talk about regeneration, why it is very important. I would like you to know literally one most important law. It is called Heflick's Law. Leonard Heflick received the Nobel Prize for this. It is very important to understand that any cell has a certain number of divisions, namely 50 to 52. This applies to all cells, somatic cells, except for sex cells, unfortunately cancer cells. Therefore, the number of divisions is clearly programmed. And this will mean that each cell has a clear number of divisions. At the end of the 52nd division, the cell ends its life cycle. Special enzymes approach it, and in a soft way in the form of apoptosis without inflammation, this cell is utilized by macrophages. This is a universal mechanism for ending a cell's life. This mechanism is the basis, first of all, of our lipolysis. And another important point is for us to understand that in our young elderly patients, their cells are at different stages of life, and the interventions that we plan to carry out with you depend on this. So, as you can see, from the moment of birth, we have a huge amount of proteins, proteoglycans, collagen type 3 or reticular collagen. Please remember, the third type of collagen, reticular or young collagen, these are all synonyms. Naturally, the amount of elastin and a small amount of collagen type 1 or fibrous. It is even there from birth because it is necessary for our dermis to maintain its structure. But as you can see from the moment with age, the amount of collagen type 1 or fibrous changes in us, and it increases. Somewhere, conventionally speaking, this is the age where collagen, the first and third types, intersect. This is conventionally the age of 30 plus years. And as you can see, the amount of collagen type 3 falls, and the amount of collagen type 1 begins to prevail. This is due to the law that we talked about, the law of Leonard Heflick. Why? Because the number of cells accumulates at the end of the Hayflick limit and under conditions of non-physiological pH of our cells, which are formed due to inflammation of the intradermal, from age and from photo damage. Our blasts produce, unfortunately, this first type of collagen. Therefore, colleagues, when talking, are we talking about collagen stimulation? It is always appropriate to ask the question, what type of collagen are we talking about? Collagens are much more than collagen of the first and third type. But for understanding, we need to remember at least these two types of collagen. The fibrous collagen is indicated in red, which, in fact, we do not need. We can have it anyway, when with the help of some laser technologies and other effects, we are given the opportunity to assure us of the formation of fibrous collagen. So, colleagues, this is no failure. For us, this is, to put it mildly, very non-physiological. Because fibrous collagen leads to disruption, firstly, of the function of the dermis. And secondly, it does not lead. Yes, it can give after laser exposure to the introduction of a number of drugs, which we will now discuss. It can give a primary physiological, aesthetic improvement, but it will very soon change to a violation of the function of the dermis, which will be expressed in dryness, and which will not pass, but we will discuss this a little later. So, here's what I'm talking about. We have two types of collagen in a normal fibroblast. Under physiological conditions, in conditions of young age, absence of diseases, photo damage, and physiological pH, it will produce reticular collagen or collagen type 3. In old age, without a doubt, even if our patient does not have concomitant diseases, but she is 50 plus years old, colleagues, you should not count on the fact that her fibroblasts will produce reticular collagen. We immediately understand that this patient, despite the absence of diseases and other things, has chronoaging or aging from age. So this is a very important point. So, stimulation of an older patient will definitely lead to the formation of fibrous collagen. So, colleagues, and for us, free radicals play a very important role in maintaining oxidation reduction processes. And these free radicals affect our tissues in very different ways, their concentration. Well, we all know what's going on with us. We always have when the cell at the Hayflick limit ends its life. In exchange, it is activated. That is when the cell by apoptosis, so to speak, begins to end its life when it is cut by enzymes. At the moment of this action, a small dose of free radicals is released. This dose of free radicals starts a dormant stem cell, in exchange for which two are formed, one in exchange not. The second is formed in exchange for the dead one, or rather not dead, but having finished its cycle. Thus there is an eternal replacement of cells. But colleagues, you will ask, why then do we age? Why is this process clearly visible on our face? Because this process begins to decompose according to certain factors. These cells become, as it were, walled up or insensitive to this small dose of free radicals. So, the first stage is our protocol. I remind you, this is activation. Why do we need to activate fibroblasts? We need to activate fibroblasts in order to change the ratio of that fibrous and reticular collagen, because we understand that the person who turned to us for help in his, let's say, rejuvenation, he has already seen changes, which means, accordingly, this is already happening at the level of the dermis. So we have a drug. This is a completely new formula. And now you see, for the first time, an updated formula that no one has seen yet. Not a single doctor, because we had stamina, which is a little different. This drug contains 4 completely different drugs that activate stem cells in 4 different ways. Please note that the isoosmolar drug contains 320 milliosmoles. And a drug with a physiological pH. Here, colleagues, 10 milliliters is a bottle. This is, oddly enough, for one procedure. Well, we understand perfectly well that we have a certain number of cells in the body. We should consider the skin not as an area, but as a volume, somewhere the area of the skin. The thickness of the dermis of a healthy person is about 2 millimeters. Accordingly, we multiply by the area, we get the volume of the dermis, we mathematically. In this way, we know how many fibroblasts are contained in 1 cubic centimeter. And for these purposes, we developed this drug, which contains exactly 10 milliliters. And 10 milliliters is, oddly enough, for one procedure, because, you know, that you inject Beretlicence 1.5 cubes, 2 there, well, 2.5. These are, colleagues, exactly the required number of milliliters in order to activate our dermatalizing fibroblasts. So, colleagues, we must precisely use the concentration. Please pay attention to the slide. This is the physiological dose of free radicals. The physiological dose of free radicals is considered to be a concentration of 0.2 to 0.5 mmol. Everything below is less, and this, as you see, blocks activation. This is a physiological or activator. And everything above 0.5, more precisely above 1, is a factor that inhibits and causes cellular apoptosis. We used lipolytic on this phenomenon. So, we will now talk about the physiological dose of free radicals. The new formula of stamina contains adenosine. This is one of the components that through its demethylation manifests, allows us to activate cells by means of this demethylation. That is, Before this formula, we used only one activation pathway. Today, it is a new drug that allows activation 4 times more effectively than the old one, 4 times safer. So wait a second, something is wrong with my slide again. If you have any questions, join me. In the course of our discourse, I can already answer them. A lot of scientific information. We even see in the literature a description that it is reported that by linking with certain recipes through certain proteins, it is adenosine that promotes the activation of our dormant fibroblasts. The next component is lactate, which means that we supplement stamina with these ingredients. In fact, we need this component for maintenance. The cycle of strength gives the opportunity to maintain it. That is, energy maintenance. The third and fourth E drug is nicotinamide. And this synthetic growth factor is well known. So, we all know very well that today it is very fashionable to drink Nadash. There is such an enzyme, Nadash, so nicotinamide, which is a consequence of deacetylating sirtuins. These are proteins, regulates the activation of stem cells and transforming growth factor. Beta regulates this process due to its profusivity. Thus, colleagues, in the new drug, which we will not find on the market either, there are 4 mechanisms of activation of stem cells, which we need so that 3 weeks after the introduction of this drug, new young reticular collagen appears, produced by our young fibroblasts. So, in this original drug, the formula of Professor Ceccarelli will be written. The production of all these preparations is carried out in a single place. This is the formation of metal in the city of Milan. This will give us confidence that this drug is original, and so on. So, colleagues, PRP, the next step, after we have activated our fibroblasts. After 21 days, we need to support our fibroblasts. And growth factors, we have colleagues. This is the second stage of our main protocol. So, colleagues, we have 2 options. The first, either we traditionally take the patient's blood from a vein, place this blood in some test tube. Today, my colleague wrote a post on Facebook that she has already tried 70 different test tubes. But today, there is no such need, since there is a drug in quantity. 10 milliliters we can cope perfectly well, because we have the main ratio of the main growth factors in this bottle. Therefore, of course, who prefers PRP? We cannot deprive him of this opportunity. But if there is no centrifugation and a number of patients do not agree to this procedure, then please, there is a drug. This drug is called PRP Biomedic, which was developed by Professor Ceccarelli, and you will definitely not encounter such. So, colleagues, what happens when we use PRP with you? Either synthetic or from your own blood. The same thing happens. We activate the fibroblast receptors. Our fibroblasts have several receptors. There are important anabolic receptors. These are receptors that will build our tissues. Please remember them. They are called CD44. So the effect of growth factors stimulates the production and activation of these receptors. This is very easy to prove. When we introduce FPRRP, yes, that is, growth factors, they attach to these receptors. And after 6 hours, colleagues, New receptors are formed in anticipation of even more growth factors. At the dawn of the development of PRP, this is exactly what they did. In principle, our protocol has such an option. It is called Super PRP. When our patient comes, we introduce PRP to him, and after 6 hours we do it again. Of course, the effect there is amazing. We will talk about it now. So, colleagues, non-stimulation with growth factors causes a functional improvement in the skin, an increase in reticular or young collagen, which is what we need, which will testify to our youth if we want to do some histology and so on. Histological tests show that non-stimulation with growth factors leads to a fairly long-lasting effect, up to 9, even 12 months. This is our concept. That is, we will get an aesthetic improvement much earlier, but it will last for 9 to 12 months. So we use the main protocol in some patients once a year, and in some once every 6 months. This is for those patients who, unfortunately, have previously had other procedures done unsuccessfully that caused functional deterioration, so we restore them at the beginning. Then they enter the regimen of once every 6 months, once every 9, once every 12. Today, stimulation with platelet growth factors is the most physiological intervention. Here I spoke about receptor recruitment. Yes, about the fact that when we introduce growth factors, after 6 hours we have a new number of these receptors in anticipation of new growth factors. Therefore, the second introduction. PRP gives a wonderful metabolic effect. This should be done, colleagues, in 6 hours. If we do it in an hour, in 2, we will not get such an effect. Therefore, there is a so-called weekend procedure. When we invite a patient to PRP as the first patient in the morning, and then we invite him again. Of course, this makes our work a little bit more difficult, but it gives an excellent effect. If there is such an opportunity, try it, yours. Your patient will be very pleased. So, colleagues, now we will talk about other effects. The same fibroblasts contain other receptors, catabolic ones, which are called CD40 and Connecticut 39. It is precisely the activation of these receptors that causes the opposite effect, blocking the fibroblast and blocking the production of reticular collagen. And colleagues, and fibrous collagen is a protective collagen. We know that after a cut we form a scar, so a scar is what it is. Collagen. Therefore, in non-physiological conditions, we will always get fibrous inflammation, because this is a protective reaction of the body. The body wants to limit the impact of an unfavorable factor, thus creating such a fibrous, let's say, barrier. Therefore, polynucleotides containing a large molecule of gyronic acid of non-physiological size. There are quite a lot of known. We won't tell you now. You can always look at the molecular weight to see. If it's thousands, then it's definitely not physiological. So activation of these receptors leads, unfortunately, yes, we can get a small aesthetic effect in the first few days of administration, primarily from polynucleotides and so on, but then there will be a functional block lasting approximately 30 days. This is the time required for macrophages to remove, cut this large molecule, receptors 40 and 39 to be unblocked, the normal process. To begin again, this takes about a month. Please take this into account. So we have Biomedic, PRP, is produced in the amount of 10 milliliters. This is also for one procedure. The procedure in our main protocol, we do it after 20. One day, the drug is a little painful, so we can, because it contains GABA. You know this drug, so we can add, if there are no contraindications. We can add lidocaine so that our patients, it was more comfortable. It is a completely clear concentration of growth factors in one bottle. It is administered intradermally with a needle, well, most often 30 to 32. Colleagues, another very important point about the administration, since we are talking about the fact that our dermis normally has a thickness of 2 millimeters, Our patients who turn to us for let's say, for help from us, then we, colleagues, must administer intradermal. We understand that our patient's dermis is far from 2 millimeters. Accordingly, let's assume, let it be 1.4 millimeters. Yes, and the thickness of the epidermis is 0.2, total 1.6. Colleagues, we must work with a 4 millimeters needle and a quarter of the needle. That is, we must hit the biological target where we would like to hit. Accordingly, we cannot prick with a 4 millimeters needle into pollen needles or, God forbid, into a whole needle. We will always go into fat. Therefore, we need to hit the biological target. This concerns both the first drug stamina, as well as PRP, and the third, everywhere we must inject intradermally. The result is a papule. So, colleagues, after we worked, namely activated fibroblasts, 21 days passed. We introduced either natural PRP or biomimetic. It depends on your preferences. It is very important for us to give the third stage. This is what we have after 2 stages. We have activated fibroblasts, young in the amount of 30% of the original. We have with you fibroblasts supported by growth factors. That is, they are already starting to function. And now, colleagues, we need to give them a substrate for building components of the dermal matrix. That is, actually, for what we are fighting. Therefore, a month after the introduction of PRP, we give a drug that is called Skin Optimize. This is a unique drug that you will not find anywhere else. You can find a lot of different barovitalizants, but you will not find such a drug. What is the uniqueness of the drug? First of all, in the fact that it contains low molecular hyaluronic acid. Namely, its fragments of hyaluronic acid. The next stage for us is necessarily bicarbonate. This is soda, yes, that is, in what conditions our fibroblast will work. Synthesize hyaluronic acid. And the third point, it contains amino acids, and the most important component of this is cysteine. This is the amino acid that blocks metalloproteinase. Therefore, the introduction of the drug Skin Optimize, in addition to the fact that it will give us the opportunity for our young fibroblasts to produce their own hyaluronic acid, we also simultaneously enlang our effect in this way. Which is contained in our dermis. The thing is that the dermis is a kind of jelly that has several states. Gel, icyl. So when we are in a gel state, our protoglycans are negatively charged. They repel each other, thereby causing exactly that tone of our skin. When there is an inflammatory process, first of all, the ratio changes. We have the so-called coagulation of the dermal matrix. We get the charge changes, our skin sticks together. Roughly speaking, therefore, for these purposes, we use a bicarbonate buffer, which allows us to work in completely physiological conditions. This amino acid cysteine, which I said, it blocks matrix metalloproteinase. Therefore, the drug, that is, we see the effect after the first procedure. Our patient sees how it comes to life. His skin after the introduction of stamina. The next stage, when we introduce PRP, we see the continuation of the effect. So we often have the third stage. For some reason they think, well, that's great. No, colleagues, the third stage is, if we want 9 to 12 months, then we must definitely do the third procedure in a month. And we will thus complete the main protocol, which will give us the opportunity to lang the effect for those 9 to 12 months. As I already said, we also introduced the 30th gain 4 in a quarter of the needle because we want to get it intradermally. We also have for one procedure, colleagues, it is calculated that all this is introduced 10 milliliters. The drug, the release form is 10 milliliters. Here are brief characteristics. Yes, the drug has physiological osmolarity, has physiological pH. It fully enables us to regenerate the dermis. Stimulate reticular collagen in physiological PARJ conditions. Contains vitamin C and contains this amino acid cysteine, which blocks metalloproteinase. So, colleagues, after we have completed the main protocol with you, we already have an excellent result. But colleagues, some of our patients also have excess fat deposits. On the contrary, a decrease in the amount of fat. So we will now consider the regeneration of adipose tissue. Or rather, now we will talk about muscle toning, and a little later about adipose tissue. So, muscle toning is a drug that contains primarily amino acids. And contains choline. We know that acetylcholine is involved in muscle contraction processes. Therefore, the main protocol consists of 3 components. But in the interprotocol between these breaks, 21 days, 30 days, Then we can supplement our efforts to regenerate other systems. That is, we should not wait for the main protocol. That is, if we injected stamina to a patient. This does not mean that on the same day we cannot proteinize the lateral portions of the frontal muscles, or work somewhere in the middle third of the face. That is, for us it is combined. Of course, we can only analyze all this in practical cases. But this protocol, it is not unshakable. It can always be supplemented with visions. And first of all, muscle toning. And so we, as I already said, we have zones where we always use botulinum toxin with you. Yes, we fight wrinkles, but at the same time we must Do not forget that muscle toning, especially after several sessions of botulinum therapy, is the regeneration of muscle tissue. What are we talking about? We are talking about the fact that when we inject botulinum toxin, we block the metabolism in muscle tissue for a long time. We block the blood flow. Our muscle is motionless for a long time, which of course leads to its atrophy. So if we are very strong toxin, then we will eventually get muscle tissue atrophy. So I recommend after 3 continuous sessions of botulinotherapy to necessarily administer a drug containing choline, namely muscle toning for muscle tissue regeneration. In addition, if you and I have hypercorrection with botulinotherapy, then we can always inactivate the drug. Side effects of the toxin. Thereby, because we contain sacchaline, we unblock the muscle. Sometimes this is very necessary, plus the middle third. As I said, the zygomatic muscles, large, small splinter muscle. We can always also stimulate with the drug muscle toning and lateral portions of the frontal muscles. Here the slide shows what will give us aesthetic improvement. As I said, we can do this. That is, if we use the drug muscle toning for procedures. Then we can inject them up to once every 10 days. Accordingly, we can in the first session inject stamina, inject maskening, and wait 21 days. When we will grow new fibroblasts, it does not prevent us from working with muscles. Why? Because muscles lie much deeper than a dermis, and accordingly we work in different layers, and it does not prevent us at all. Therefore, in one procedure there are combined procedures exactly as with fat, and so colleagues. Here in our patient, you see how the upper eyelid was. Here in our literally in a few hours, this eyelid was lifted. Due to what? Due to the fact that we stimulated this part of the verbal muscle. This speaks of its rapid effect. Our task was to lift the upper eyelid a little. That's because in this patient it was hanging so much that it narrowed the field of vision, as we were told, ophthalmologists. This condition is called blepharochalax. Therefore, we do not know such a term in dermatology. So, colleagues, of course, we will talk in more detail about the drug maskening. Because it is used throughout the body, it gives excellent effects. It is used for the regeneration of chest muscles and so on. We just need to know that there is a drug that regenerates muscle tissue where it is needed. Let's move on to the next part. This is fat regeneration, using the latest scientific data. We can, on the one hand, reduce fat deposits, as we've already talked about, where it is necessary. This is usually the lower third, the middle third of the face. These are the molars. This is the area. This is the cheek area. On the contrary, restore the lost volume of fat, where it is necessary. And this is just the eyelid splinter transition. This is the lower eyelid. This is this area. This is primarily the chest. So there is a drug called fat apoptosis, which contains that large amount of millimoles. Yes, millimoles, that is, above 1 millimoles of free radicals. So it consists of two phases. It consists of two main drugs. This is trivalent iron and vitamin C. Mixing which we get a fast-acting solution of these free radicals, which we must use within an hour. That is, this. In an unmixed state, this drug can be stored. The shelf life of drugs is 2 years. In a mixed state, it is no more hours. Well, different ratios are given, as we can, if we need ready. Solution. Then we mix 0.1 with 0.9 and so on and so forth. So, what happens with why? Why photoapoptosis? Because, colleagues, well, the founder of lipolysis is deoxycholate. This is a drug that gives an excellent effect, but unfortunately, and the same number of side effects. As you see, it has been used on the market for more than 20 years. Here's the main problem that children tolerated by patients. The cell is destroyed gently during apoptosis. Literally, the process occurs within 2 days. The patient does not feel any desires, pain, and so on. Yes, during the procedure, especially in the upper jaw area. If we work close by, we can feel a little discomfort. But this is also solved with lidocaine and a little swelling for 20 to 30 minutes, and the process is quite gentle. The effect is quite fast, and the effect is lasting. And as I already said, without an inflammatory process. Method of application. It is very important that we clearly understand the dosage. Here, phototosis is a drug. All our drugs are dosed, but photoapoptosis especially. That is, if we want to get uniform fat burning, we must apply markings, 1 per 1 centimeter. That is, we must do it where we want to produce. Or policy, especially this concerns the face. Very often we know that we have asymmetrical faces. Accordingly, colleagues, we can, on the one hand, suppose, apply 5 cubes there with a friend, on the other hand, 4, depending on the symmetry of the face. For this purpose, we draw a marking of 1 centimeter by 1 centimeter. In the center of this cube, we introduce 1 centimeter, 1 milliliter per 1 square centimeter. We use a 6 millimeters needle M in order to get into the fatty tissue. It is very important to observe the dosage and marking, because it seems to us that we think that this is a centimeter. And often when we ask our colleagues to draw a centimeter, they draw 2 centimeters. Accordingly, an under effect, we can apply as many milliliters as we want. The main thing is for us to use a milliliter per centimeter. On the body, we have quite large volumes. If this concerns the abdomen, then we can apply 50 and 100 and more milliliters. If this is a face, we depend on the type of face. We apply again according to the marking. These are colleagues, histological studies of our colleagues from Odessa, which prove that when using photoapoptosis, does not occur. You see, we saw studies on the 1st, 2nd, and 7th days. That is, the material was introduced, by the way. The material was taken according to all the rules of research. Biopsies were taken from rats. And we saw exactly apoptosis. This is one such tummy we had. Here we injected 126 milliliters of fat. Injected along this marking. That is, here you can even see small bruises after the injection. That is, we drew cubes here centimeter by centimeter. Here we received literally after, I don't know, 5 days, this is the result. The patient was immensely happy because I see that the result, as they say, is on the face. Here are colleagues, my favorite, one of the favorite procedures of this management. So, for such an eyelid, colleagues, we need only 0.6 milliliters of fat. Here 0.2, 0.2, 0.2. That is, roughly speaking, for 2 eyelids we need a milliliter of fat. Only 1 milliliter and we see such a wonderful effect. These are hernias of the lower eyelid, which are hernial protrusions. That is, here are such fat bags and we carefully with a needle. Here it is not even 6 millimeters, but a 4, carefully make 3 inclines. We get this effect literally in a day. Here the girls also entered a very small amount of photo. She took off her braces, she has such a face. You see everything is puffy and we literally carried out this procedure called facial relief. That is, before the start of regeneration. This is also a fairly common procedure. When we enter a small amount, that is, well, let's say here maybe 3 cubes, maybe 4. 4 cubes were entered and you see the face is completely different. It looks. So we looked at lipopolis, but you see the patient, as I already said, has gravitational tosses. This fat slides here and here, it is just not enough. Here, of course, it is advisable to apply the lipogenesis procedure, just as it can be used on the patient's hands and chest. So, in 2006, 2 professors, this is a colleague of Maurizio Ceccarelli, Victor Garcia, at an event in Geneva. It's called Biograde. They presented this mechanism, which is called liposoving, or it turns out forced transport of triglyceride into one's own cell. That is, this is the basis of the effect of lipogenesis. So using the latest data, we can do all this. You've already seen this slide. So, colleagues, this is a young man who was injected with a lipogenetic solution, right here in this part, where you see there was not enough fat. Here I am injecting mine. Or lost fat, right here. We palpated it and we clearly saw the effect. This could be done on the face, this can be done on the hands, and this can be done, colleagues, on the chest. We will not consider the chest today. This is a rather sensitive topic. We only do this in full-time training. So, colleagues, after we have knowledge of the relativity of skin biostimulation, it is very important that we know that there is an opportunity to work with fat in 2 directions. There is an opportunity to tone muscle tissue, yes, which is used on the face and body. We move on to restructuring or scalpless lifting. Here we have a drug that already contains a non-physiological pH. You see, pay attention, 5.8. It is also hypoosmolar. This is the drug that when administered forms fibrous collagen, and we need it just in those cases. When we need to sew the skin, yes, these are stretch marks. This is atania in the shoulder area. This is pliatisma. Yes, the drug is quite painful. Therefore, it has a non-physiological parasha, contains both vitamin C and contains all the acids. Accordingly, we add lidocaine when using it. I will show you several times now. To work, how it works. This is, but unlike the same lasers and other effects that lead to the formation of fibrous collagen, here we can dose with our own hands. Why? Because we drive papules where we need, and we control this process. Here, colleagues, one of the protocols, namely the so-called Brazilian butt. We will form this part, this fibrous capsule. We strengthen the buttocks. We stimulate this part with the drug muscular toning we get. A pronounced effect, but I remind you, this procedure does not apply to regeneration. This procedure is specifically aimed at strengthening and creating fibrous. Well, as you can see, the woman in the slide is already far away, probably over 60, in these age groups. Even with the use of stamina, we have huge questions about whether regeneration is possible, so this decision was made that we are changing the aesthetic appearance. And colleagues, of course, it is not limited to this.